Hospital inventory is really critical. It's a big investment that the healthcare system has, and a lot of people, including physicians, have particular pharmaceuticals and drugs that they want. So at Monarch, we have experts in understanding and knowing what the pharmaceuticals. So you guys know it. Every hospital system down in the doldrums, down in the basement, has between $1 and $5 million in a pharmacy that has to be delivered to a room. So having product available for your patients is incredibly important. We can help you understand that chain of custody and count pharmaceuticals to make sure you understand your inventory to take care of your patients and your physicians. On the flip side, the other element of a hospital inventory or healthcare system inventory that we have found is oftentimes in greater chaos are the materials or the supplies that the nurses care about more importantly than the physicians do, because you need tongue depressors, you need IV bags, you need gauze, you need Band-Aids. They come from 5 different suppliers. Our experience has been that even since COVID, when there were shortages on these types of things, that hospital systems have 5 different part numbers for one Band-Aid, and the inventory is all over the place. We can help you not only get your arms around that inventory, but migrate from counting to controlling to managing that inventory, and oftentimes reduce your materials inventory by 50%, which is incredibly beneficial to both the hospital and the healthcare system. So I'm going to go back to different types of inventory in the healthcare system. We have pharmaceuticals, we have materials, and the third thing that's really, really important is the fixed assets. A hospital system and a care system has to really understand what they spend their millions of dollars with in the healthcare system, and that they track that CAT scan machine, for example, that X-ray machine, the pieces of equipment that go from room to room to take blood pressure and so forth. That balance sheet, the CFO of that healthcare system wants to know exactly where those assets are in that room, in that hospital, and we can help them get their arms around that too. So that's for the balance sheet. All 3 of those assets sit on the balance sheet. We can help you understand and manage each of those for their healthcare system.